There are a number of important things on plantar fasciitis treatment. San Francisco residents need to know if they are planning on solving this problem. The biggest problem with this condition is pain. The pain is characteristically severest in the morning hours and abates as the day progresses. If this is not addressed adequately and in timely fashion, it may cause gross impairment of normal function. Experts strongly recommend early intervention for favorable results. Research has shown that the prevalence is particularly high among athletes. The reason for this high prevalence is excessive straining of plantar fascia, a flat sheet of tissue stretching from the heel to the base of toes. The straining results in an inflammatory reaction that causes extreme pain. Apart from athletes, the problem is also common among people who wear improper shoes for a prolonged period of time. Pregnancy and obesity are predisposing factors. When you first start noticing any form of discomfort, you will be well advised to seek treatment immediately. This kind of behavior has been shown to result in better outcomes as compared to late intervention. Resting adequately helps to give time for the affected tissues to heal and for the symptoms to abate. Intense physical exercises and walking on hard concrete aggravates the situation and should, for this reason, be avoided. Conservative therapies should be considered in the initial stages of management. These therapies are effective in at least 9 out of every 10 patients, provided there is good adherence to the prescribed plan of management. A majority of them show significant improvement within the first year of therapy. It is a very common practice for different therapies to be combined in a bid to get the best outcomes. The success of the therapy heavily depends on symptom severity and the type of therapy. NSAIDs or non-steroidal anti-inflammatory drugs are a common choice of medication for persons struggling with this condition. Common drugs in this group are aspirin, ibuprofen and naproxen. These should only be used for temporary relief of pain. If the pain persists, one should see a doctor immediately. Overusing these drugs may lead to unwanted side effects, such as renal failure and peptic ulcers. Improper shoes are an aggravating factor and should therefore be replaced. The shoes chosen should be good at shock absorption and arch support. Cushioning is enhanced through the addition of orthotics to help reduce the strain exerted on the heel and other pressure points. Both feet must be considered for this replacement whether or not both are involved. Physical exercise done on a regular basis has a major role to play. Exercise is preferably done early in the morning after waking up. Some of the most preferred routines include stretching of the calf and the toes and towel stretches. The exercises are aimed at improving ligament flexibility and increasing arch support. If having plantar fasciitis treatment, San Francisco patients should know that different patients take different times to recover. This time is therefore shorter in some people and longer in others. Patients need to have regular clinic visits to assess their progress.